This is Scott Becker with the Becker Private Equity and Business Podcast. We join you regularly to sort of learn something, to help we're learning something, you're learning something, to be entertained some and to learn about business. We're visiting with brilliant leaders in business and private equity. Today we've got one of those. We've got David Pivnick, who's one of the smartest people I ever get to visit with, both brilliant and one of the quickest minds of anybody I know. We're sort of visiting today on what's a tragic day. The CEO of UnitedHealthcare was tragically shot dead today. And we talk so much about leadership matters and how important leadership is. United, the tragedy of this, of course, horrible tragedy, but also has outperformed all of its peers. In a year where we've seen so many franchises and companies struggle, Intel under horrendous leadership, Chrysler, Jeep, Stellantis under incredibly poor leadership, both losing their jobs. Chicago Bears just horrible. Blackhawks horrible. David, talk to us about leadership and any thoughts on this tragedy. United, of course, we're often in healthcare, and it's one of the biggest names in healthcare. It's also the fourth largest company in the United States by revenues. Any immediate thoughts today as you watch this play out across the news, the tragic shooting of the CEO of UnitedHealthcare?
I mean, first of all, it's certainly tragic, and tragedy is an understatement. I had just heard about this a couple hours ago on a call with my wife, actually, and she had mentioned it, and I think it's incredibly unfortunate and a somewhat sad state of affairs that it really goes to show that no one at any level or of success or otherwise is sort of immune from some of the real world problems that exist. So as a more general global statement, it's really unfortunate, specifically, obviously, for Mr. Thompson and his family, but just sort of a sad indictment of the state of affairs generally, where you never know what could happen on any given day. It sort of is a good and somewhat humbling reminder to not take any days for granted and to appreciate life. More generally, for an organization, we've talked a lot about leadership and establishing culture, and I don't think there is a playbook or sort of a recipe, for a tragedy of this level and a change in leadership that's completely outside the company's control and caused by unforeseen external factors that not only require an unexpected change without time to prepare, but also frankly create issues in the organization where I assume employees some will require counseling and otherwise. So I think, fortunately, United is a big and strong enterprise with many good leaders, not just, at the CEO level, but obviously a strong corporate structure more generally. So it will be positioned to adjust and to, find the right fit as the next leader. But I just don't think there's sort of a ready playbook when something truly tragic and unforeseen of this nature arises.
And talk about for a second, are you going to get to a spot where you don't think of this, but some of these healthcare CEOs are in this horrible situation where they have to authorize care, deny care, manage the care. They become so easy to become sort of demonized. Will there be a point in time where so many people are vying for this job, but people will be a little scared to take this job because it's such a high-profile job? It's one of the largest companies in America. We've seen people in our own neighborhood that have gotten so rich, you think they're almost worried that the kids are going to get hijacked or kidnapped or something like that. Is there ever a time where it's scary to become? It's obviously, if you're the president of the United States, you run the risk of being shot all the time. Is that the chance at some of these large companies too, that it's going to be that you become a target for people just because of God knows what?
I mean, the short answer to that is I certainly hope not. It's a scary thought. Your question is sort of reminds me of a fairly old Denzel Washington movie. I think it's called John Q, where he plays a father whose son needs medical care and he takes hostages in a hospital to acquire it. And I certainly hope that's not the state of healthcare generally in the United States. But I say that recognizing that the level and availability of care and insurance coverage varies greatly for different people, and that can cause people to act in desperate ways. I think in terms of leadership roles at a healthcare company, I would hope that's not a concern for good leaders and talented executives, and I would frankly also hope that as a general statement, individuals who are aggrieved with regard to the quality of their health care would recognize that ultimately, that's not coming at a decision being made by the CEO, that there are organizational considerations, and frankly, the concern really lies more at a global level or countrywide level, national level, at the state of healthcare in the nation and its availability, because the insurance companies are sort of operating within the framework that's been set, and things like utilization management are part of that, including, by the way, at government-funded healthcare programs. There's some forms of utilization management and other considerations that come into play, particularly in the provision of care. So I think, the short answer to your question is I hope that executives are not at risk for reasons like that. They certainly shouldn't be. I think that should go without saying, and it's a more nuanced discussion as to how others are reacting that I think requires more of a global solution to ensure that every American has access to healthcare as required in things like GoFundMe, for which I increasingly see people posting about and asking for support where medical needs arise, isn't the sort of solution for people who require healthcare.
Yes, no, you're 100%. So we're watching this today. We're watching really this tale of two cities in healthcare. Some health systems doing great, some doing poorly. Some private equity funds did things doing great. Some really struggling. I obviously just saw another practice management company that went broke. What are some of the things that you've got your eyes on? Obviously, today is sort of taken over this fascinating tragedy, a horrible situation. The United CEO. And just so fascinating in so many levels. It's obviously not like when President Trump got shot at in Pennsylvania, but it sort of does ring the public consciousness in a way that not many things do. What else are you watching? What else is top of mind for you today as you're watching things out there?
Well, I mean, as a general statement, we've talked about before, one of my most pressing concerns that I think about more than most other issues is the general wealth gap in the country. And I think the concerns and the questions you raised about availability of healthcare and how that might, all my words, not yours, but might foster resentment and create risk for executives. I mean, that is, as a general statement, concerns about differences between haves and have-nots in the country, whether it's, access to healthcare, whether it's quality of education and housing. There are so many of those issues, and it seems like the middle class is shrinking, and the difference between the truly wealthy in the country and folks who are struggling day to day is continuing to increase. And I think that is a significant issue that has a big impact had a big impact in the recent election and is continuing to be a major trend in elections going forward. And I think from a safety standpoint, generally day to day, but also for the well-being of the country, I think that's a big concern, and it's something I think about a lot. And today's issue may be a crystallization on a sort of micro, unfortunate, significant level of a broader problem that continues to exist.
But this is a fascinating issue, and I think what happens is you've ended up very broadly with two very different classes of people in this country, and it plays into everything. And I often talk about it as the capital class versus the working class. So the capital class means you've got investments in money in the stock market, and that might be roughly half of the country. And so as you've seen the market blow up and go very high, that class has benefited. Then you've got another part of the country that actually has almost no money in equities, almost no savings, no cash, no money, and they have gotten zero benefit from this huge uplifting of the stock market. And you might say in the truest trickle-down way, because of that, there's jobs available and stuff like that. And there's probably some truth to that. But in the big scheme of things, that half of the country that is not seeing the stock market increases is dealing with inflation, is dealing with wages that aren't going up as fast as inflation. It's almost like our health systems. they've got reimbursement going up very little, but their costs going up significantly. And think about that as like half the country that almost needs no benefit from the stock market being out of control. And it's similar in healthcare. I mean, more and more you've got the situation. So I love your point here. More and more in healthcare, you've got in Florida, if you want a primary care doctor, you probably need a concierge physician today if you want somebody to actually take care of you. And that just from a health equity perspective is ridiculous. It means that, anybody that's not paying the couple $100 a month is ultimately really slow and delayed in getting care. And it's a supply and demand issue and a lot of issues. But I think your point is well taken. And somehow it's got to be a both the capital class and the working class thriving. And it's complicated because the capital class is thriving on what I think of as a lot of artificial wealth creation that's not necessarily sustainable. And the working class needs better and higher wages. So I don't find easy answers to the whole thing. I really don't. I think I think your point is really well taken. It reminds you of like the different periods of time where a person in labor shot a CEO and it ticked off almost an internal civil dispute or challenge. And your point is so well taken, taking those two things together, because I think it's a fascinating talk about a corporate mega CEO being shot and the big disconnect between the working class and the capital class in our country.
Yep. And healthcare is unfortunately at sort of the epicenter of that because it should be such a fundamental basic right and obviously is important to everybody's well-being. And I think there are complicated questions there. Like as you know, obviously I grew up in Canada where there's public health care and, access is not an issue, but the availability of services is an issue, and the timing to get treatment and the nature of the treatment, the amount of approvals and authorizations to get a CT scan or an MRI at a hospital in Toronto, for example, is much higher than what would be required at a hospital in Chicago, and the wait time for that or for surgeries, et cetera, is dramatically longer in Canada than in the States. So there's pros to certainly everyone having access to healthcare, but also detriments in terms of the availability of that care and how long it takes to receive treatment. So I don't know that there's a perfect answer or a perfect solution. I tend to think in some ways, ultimately, we may end up in a situation down the road where there's two-tiered healthcare and there's a private option and a public option, which I recognize is controversial to many folks because they think it's not appropriate that anyone would receive sort of second class or lower tier healthcare, which the public option would be perceived to be. And I think that's a valid criticism, but I think the counterpoint to that, which I view as winning the debate personally, is if someone currently doesn't have access to healthcare, having access to healthcare that's not as good as someone else's healthcare is still a massive upgrade from no healthcare at all. So it is not to suggest that a two-tier system would be flawless. There's clearly an obvious flaw that exists. And it's a bit of a first world comment for me to make to say it's still an improvement, but practically speaking, it is still an improvement. And I think that may be the type of thing that is ultimately required, because I don't think there will be broad-based support for just, making Medicare for all or something of that nature where other people who currently have healthcare are going to be impacted.
Yeah, and I don't get the impression that our country is that far away from wanting coverage for everyone. The challenge becomes one of supply and demand, because we're up to about 90% of people have coverage. If some of these subsidies in the ACA go backwards a little bit under the Affordable Care Act, that will bring that number back up a little bit. But coverage is a key part of the problem, but just a starting point. Access is, I think, the larger and bigger point. And if we don't fix the supply of physicians and nurses and grow that in our country, access for everybody is going to be a real challenge. I think more people on the right and left believe that everybody should have coverage. I don't hear a lot of people on the right just saying, let them suffer, not have health care. I don't think people feel that way. I think it's more now becomes solving a problem of how do we have enough physicians, nurses, healthcare force to take care of everybody. I know in the countries that have gone the RFK route of trying to nail everything to preventive care or nail everything to everybody taking care of themselves better, that's been a disaster and it's the stupidest idea I've ever heard. and it's not that I'm not a fan of RFK. I just think it's fine, but we better have enough doctors and nurses in healthcare workforce to take care of people. We just can't count on preventative care. They tried that in China and India without enough doctors and nurses, and it's a disaster. We can't have that here.
Yep, that's a valid concern.
Anyways, David, it makes my day to get a chance to visit with you. David Pivnick, partner at McGuireWoods, like one of the brightest people that I know. I try not to say it out loud because he gets so overconfident, but he actually is a gifted, brilliant person. David, thank you for joining us today on the Becker Private Equity and Business Podcast.
Thanks for having me, Scott.